Good evening and welcome to the introduction of the UltraGlo procedure, performed with the Lutronic Ultra 1927 nanometer thulium laser. We're all in for a treat tonight as Dr. Melissa Levin will be our esteemed featured presenter. I'm your host, Dan Sullivan, a product manager here at Lutronic. We are extremely grateful for all of you for taking your valuable time to join us this evening. Over the next 45 minutes, you will learn about the Ultra laser and how it has revolutionized the non-ablative resurfacing domain and changed how many practitioners and patients view the capabilities and safety profile of skin rejuvenation devices. Type your questions into the Q&A box at any time. Dr. Levin will address as many as possible, but due to the high volume of virtual attendees, we may not get to everyone. Don't worry, if we weren't able to address your question, a Lutronic representative will follow up shortly. This session will be recorded and made available on demand. So without further ado, I'm thrilled to introduce an incredible person, a wonderful friend, and an outstanding award-winning board-certified medical, cosmetic, and surgical dermatologist, the founder of Entiere Dermatology in New York, Dr. Melissa K. Levin. Dr. Levin received her BA with summa cum laude and Phi Beta Kappa from the University of California of Los Angeles and earned her MD from UCSF, graduating as a member of Alpha Omega Alpha Honor Society and completing the prestigious Doris Duke Charitable Foundation International Clinical Research Fellowship. After completing her internal medicine internship at the California Pacific Medical Center as the best intern of the year, Dr. Levin trained at NYU Langone Health, where she won awards for her research in laser surgery and received the Morris Leiter Award as the best all-around resident for excellence in dermatology. Dr. Levin previously served as the Director of Clinical Research at Marmor Medical, as well as the Assistant Clinical Professor of Dermatology at Mount Sinai Hospital. Dr. Levin currently serves as Clinical Assistant Professor of Dermatology at NYU Langone Health and on the advisory board of leading dermatological brands. She is an invited lecturer for both national and international conferences and serves as a reviewer for numerous medical journals. She is frequently sought out as an expert to editors and writers from major medical outlets and serves as a consultant on dermatology for multiple consumer beauty and skincare brands. She's an active member of the AAD, ASDS, and ASLMS. Global dermatology is a passion for Dr. Levin. She serves on the Skin Cancer Advisory Committee for Standing Voice, an international non-governmental organization based in Tanzania, and plays a leading role to the research and training of skin cancer prevention, diagnosis, and treatment. And on that note, I will turn the session over to Dr. Levin. Please take it away.
Thanks, Dan, for the wonderful introduction. I'm really excited to be here to speak to everyone about, Ultra, as well as my experience with LaserMD Ultra, and really getting down into something really exciting coming down the pipeline and already here for you as LaserMD Ultra users. So let's get to it. So I look at Ultra as really the best in its class when we're really looking at skin rejuvenation and resurfacing. First and foremost, it is a non-ablative resurfacing laser, as we all know here. It's really not just great for skin rejuvenation, but it really utilizes and harnesses intelligent technology. Incredibly comfortable, very low downtime for your patients, and most importantly, as our patient population becomes much more diverse with different skin types, it's really safe and effective for all skin types, which we didn't used to be able to say with a lot of our resurfacing laser options. One of the other reasons why I really love Ultra and recommend it to many of my colleagues is really the fast return on investment because of the versatility of the Ultra platform. It really is the most powerful thulium on the market, as well as the fastest. The treatments can be as short as 5 minutes, or it can be more extensive for up to 15 to 20 minutes. But even then, you're pretty much in and out of the room, but really delivering a very effective treatment with minimal downtime for your patients. And also there are a couple of unique features with the Ultra in terms of different proprietary serums, masks, and of course, Keralase that's combined with the Ultra treatment. We're going to be also announcing something really exciting, which is the UltraGlo treatment. It's really revolutionized many practices because oftentimes we think about having or needing to have multiple platforms in our practice, but really the LaserMD Ultra is such a versatile platform that can do so many different things for different patient populations, and we'll get into that. So, as I mentioned earlier, there was limitations in a lot of the more traditional resurfacing lasers. One, as a business owner and someone who runs a practice, is the high disposable, and of course, the cost of the device itself. Many other business models, particularly resurfacing lasers, were based on high price consumable stream. Many of you, if you already have an Ultra, know that consumable is very low cost to the business, as well as, obviously this makes a difference in terms of your ROI. Secondly, skin type. I mentioned earlier that, in the US, particularly, we are seeing more and more population with diverse skin type and extensive kind of combinations with different Fitzpatricks. So this bulk heating that we used to see with traditional resurfacing caused a lot of complications and really limitations in terms of higher settings that we would often need, causing post-inflammatory hyperpigmentation that we saw sometimes up to 20 to 30%. To me, that's unacceptable for our patients, and really, still wanting to deliver treatment options for them. Thirdly, pain. Many of you probably have had resurfacing treatments yourself or performed many on patients, and pain is always an issue. When procedures are painful, patients don't want to come in for those procedures. It's important to have treatment options that make patients want to come back for their treatments, but also making sure that we're delivering effective results as well. And lastly, efficacy. There are so many treatments for wrinkles and scars. There are many underpowered, under-promised devices out there that provide little efficacy. So patients then feel like these treatments don't work, when in fact, oftentimes they may need a series, as we all understand and know. But if it's too painful, if the price is, exorbitant and unable for the patient to assume, then we're not giving our patients the results that they deserve. So, I really wanted to go and look at the different wavelengths of resurfacing lasers. This isn't to say that one wavelength is better than the other, but it's really important for us to understand why we have different wavelengths and what is the role of each wavelength for our patients. So the Ultra, as we know, utilizes the 1927 thulium wavelength. It's really the most ideal. I call it the Goldilocks wavelength for non-ablative resurfacing. When we say non-ablative, it means that we're creating these small microthermal zones that really enhance and increase permeability of the skin. You can see that beautiful separation between the epidermis and dermis there that really give that coagulation that you see. The non-ablative wound, we know that it results in faster healing times than the more aggressive ablating treatments. And it's very effective for pigment, photo damage, as well as other more superficial conditions. I explained to my patients that this is really the darling wavelength when we're talking about pigment and sunspots. When you compare it to other non-ablative resurfacing lasers, you can compare that to the erbium glass 1540. This is 13 times less, has a lower water absorption coefficient, 13 times less compared to the 1927 thulium, which allows really our users to kind of varying the level of denaturing that top epidermis. So with a thulium, we know that we're going down to 200 microns. But if you look at the 1540, it's kind of a larger kind of, I like to compare it to basically, a branch falling off the tree, and it's really falling all the way down, hitting much more. And sometimes you really don't need that. It's also causing more downtime for our patients. And when you're really looking to treat brown spots or fine lines, you don't really need to get that deep. Well, then we go into ablative resurfacing. We know that there's two different wavelengths for ablative resurfacing, the 2940 erbium or the CO2. You get that kind of extensive ablation that you see with the full disruption and ablation of both your epidermis and dermis, and that extra thermal sock that you can see on histology, which much longer downtime, much more complications, prolonged healing time. In my patient population, patients really don't want that type of downtime. It's definitely still, a great wavelength. Ablative resurfacing lasers we love, but in my practice personally, I have not just the 1927 thulium, but also an erbium, as well as a non-ablative diode 1470. They all have different roles in my practice. I do have to say that the 1927 Ultra is really kind of my hero, my go-to, because I treat a lot of pigmentation and superficial skin conditions. So really the Ultra experience, it's a 1927 thulium, great non-ablative resurfacing for patients of all skin types. It's really great. You know, I live in New York, so definitely there's a seasonality of laser resurfacing, but with the Ultra, we're able to treat patients all year round very comfortably and effectively. It's incredibly customizable. You can do very light, low treatments to also high treatments in terms of intensity and what you're treating. So this really creates a really fantastic patient experience as well when you're really looking at comfort, but also delivering results in a very kind of consistent way. So, you know, the cleared indications you can see down here, actinic keratoses. I'm a dermatologist, so I do lots of skin checks, and we see a good amount of sun damage with actinic keratoses. And so there's different settings that we use when we're really treating AKs as opposed to benign pigmented lesions such as lentiginous, macular seborrheic keratoses, and in my practice, particularly melasma. So I just really wanted to highlight here that, you know, the intelligent technology that Lutronic is really known for. You know, we've seen that. I know this is not a genius radio frequency talk, but we've seen that quite extensively with their other radio frequency microneedling platform. But we also see it here with the Lays MD Ultra. Really, the Ultra moves at the speed of the user. So not too fast, not too slow. Same concept with the Goldilocks. So these magnetic rollers that are embedded in the Ultra really quickly identifies how quick the practitioner is moving, and it adjusts the rate of fire accordingly. There's also something called controlled chaos technology, and this allows the Ultra to deliver laser energy in a manner that evenly distributes the pulses, and this doesn't cause overheating and really blends the treatment and helps avoid those grid marks that you can see with other resurfacing treatments. The total energy is displayed on the screen, and that really helps the user deliver a very consistent and quality treatment every single time. So this is that kind of random mode controlled chaos theory that I talked about, really even treatment, ensuring patient comfort and safety, and minimizing the risk of complications, particularly post-inflammatory hyperpigmentation. So, you know, there are many different operation modes for the Ultra. In my practice, about 90% of the time, I'm using the random mode, and that's really utilizing and harnessing that controlled chaos technology that I spoke to you about. Oftentimes I am coupling and using the static mode when I'm switching over the C5 tip, really for actinic keratoses or kind of more stubborn pigmented areas such as melasma or macular seborrheic keratoses, and I'll get into that later. So this is really a short video that I'll play here. I want you to really focus on here when it switches over to random mode, and you can see that controlled chaos in action and then moving over to the stamping. With the Ultra, you're actually going to change your tip to that C5 tip, and we use that a lot, as you guys know, with the Keralays. See that stamping there again. And just that versatility of the Ultra platform. This is really talking again about the speed of which the Ultra moves and how it's consistently delivering the same amount of energy. It really uses that magnetic roller that I spoke to you about. It's also showing you the amount of energy that you're laying down and dosing it appropriately. The static mode is really easy to use with the Ultra platform. You can actually choose interval so that you can give repetitive pulses without having to tap on the foot pedal. So really ease of use as well. So that C5 tip stamping mode that I spoke to you about, that 225 is really the highest density coverage. I really like that for kind of thicker actinic keratoses if I'm doing a full face that has almost like field therapy. Then for certain areas, maybe hypertrophic actinic keratoses, I'll use the C5 stamping mode. And in my practice, I see so many patients with melasma. I actually do use the 225 highest density coverage for my melasma patients. Obviously, you want to make sure they're not tan or anything like that. But we do get beautiful results, particularly when I combine with tranexamic acid ampules, and obviously good skincare afterwards. This is really a special feature of the Ultra, and it's really showing how with the C1 roller, you're getting that 200 microns width, or the diameter, and with the C5 tip, we're able to extend that diameter to 350 microns. And it may seem like something that is not important, but actually this is really crucial in its ability to go over kind of more problematic, stubborn pigment areas like melasma, like these stubborn lentiginous or macular seborrheic keratoses. And it allows us to deliver extra energy, but without overstimulating those melanocytes. So you have a lot of energy that's poured in a very, very shallow manner across a larger diameter. So if you look at that C1 roller, you're getting 300 microns deep, 200 microns diameter across, as opposed to the C5 tip, you're getting 350 microns across and 200 microns depth. And that really allows us to kind of treat these more problematic areas, be much more precise rather than putting the same settings throughout the entire face, because we now know that certain areas need more targeted treatments. This also makes it so that the versatility of the Ultra is incredibly unique. So you're able to kind of do more combination treatments with just changing the tips very easily. Interestingly, when you change the jewels, your depth actually stays consistent, but actually that width expands. And that's really because of the thermal spread. But this is something really cool that I wanted to highlight that I use quite a bit in my practice. So, just thinking about your patient selection, really any skin type is appropriate. Anyone who's looking for improvement, not only of pigmentation, so post-inflammatory hyperpigmentation, dyschromia, melasma, lentiginous, actinic damage with poikiloderma, but also improvement in really fine texture, fine lines, pore size. It's almost like a buff and shine that I like to explain to my patients. The other big thing is minimal downtime. We are finally entering into a recovery phase, getting out of the pandemic, hopefully. So many of my patients are excited to restart their social engagements, and they really are not looking for downtime anymore, as opposed to maybe in this past year. So very little downtime, maybe not totally ready for a more aggressive treatment like an erbium or a CO2, which is why the Ultra is so great in younger patient populations. But to be quite frank, many of my patients in their 40s, 50s, 60s love the Ultra. This is why it's the backbone of my practice when it comes to resurfacing, because everyone is really focused on treating more superficial conditions with pigmentation and fine lines with very little downtime. Other patients that could also be a great candidate for the Ultra is actually those who don't tolerate kind of that rubber band bright light snapping that you get with intense pulse light IPL or broadband light BBL treatments. Myself personally, I'm a big BBL or broadband light user. I love BBL. Some of my patients, they hate that bright light. It's not really the pain of the BBL, but it's that bright light. So I switch them over to the Lays, or I go back and forth between the two platforms, and we really get a great result from that. Also men, with the BBL, IPL platforms, we're really limited in terms of hair bearing areas because you can obviously cause a little bit of reduction in their hair or even hair removal fully. And so this treatment is really well tolerated, does not affect hair at all. So we're able to treat face, neck, and then also chest as well. So off the face. So I really am excited to actually speak to you about the Ultra Glow. It's a newer treatment that Lutronic is marketing, but really it's really showing you the commitment that Lutronic has for us. And it's not a new laser. To me, it really gives an idea of kind of the power of Ultra in terms of ROI. We don't want to have so many devices in our practice, but sometimes, as physicians, we think, oh gosh, like I need to get a different device to offer a lighter treatment, a different device for a more aggressive treatment. But really, Lutronic has worked to figure out kind of that versatility, basically a stronger, more aggressive treatment for more actinic, heavily damaged skin, or those who really just want a low lifestyle impact, freshening up, healthier skin, increasing that natural turnover of your skin cells, helping with sun damage, fine texture, pigmentation, but really still wanting to do something. This is, the Ultra has really become my go-to treatment. A lot of times during this time, people are a little bit nervous about getting a laser in, particularly because people are right now wanting to travel and still figuring out their travel plans. So they're not really sure about their sun exposure, but they want to freshen up for the summer, for their re-entry into social activities with very little downtime. So the Ultra Glow has been my go-to treatment option, and patients absolutely love it. You can package it into multiple sessions for prejuvenation and also improving results or maintaining results of maybe a more aggressive treatment that they do in the winter. But they feel like they're doing something, they're coming back into your practice, they're spending more time in your practice, which then increases the ROI of the other offerings that you're having for your patients. No anesthesia, I don't even numb, I just blow a Zimmer on them. Really safe for all skin types, very low consumable costs. In my practice, I don't delegate, but this is a very easily delegatable procedure to an esthetician who is trained in laser or a mid-level provider. So this is really to show you that Lutronic has basically sent out brochures to all Ultra customers. So if you didn't get them, make sure you reach out to Dan. Personally, myself, I'm a pretty digital practice. So I use these brochures digitally and I upload it on my marketing platform so that patients are aware of this treatment and they may not even know that it exists. So, it's really nice to have these assets to further educate your patients of the different offerings. Because sometimes patients think that one laser only does one thing. So it's nice for them to understand the versatility of it as well. So a couple of BNAs that we can go through, you really see, the improvement of, not just, her lentigines, but also her fine lines, particularly around her crow's, as well as the forehead. And you really see kind of that kind of smooth, even appearance in, an older patient here. This is also another patient closer up after a series. In my practice, I like my patients to understand that, we're first going through a corrective phase, and a corrective phase is a package anywhere between 3 to 4 sessions spaced 4 to 6 weeks apart, and then we go into their maintenance phase. See here. Here we go. Same patient here, really looking at that larger macular seborrheic keratosis, not totally gone there, but really lightened up. And you can see that improvement of the dyschromia in her mid-face, mid-cheek region, as well as extending down to her, perioral rhytids there. Obviously, she still has these deep nasolabial folds, but you see an overall general improvement in her fine lines as well. Obviously on the left, you see this patient who's heavily pigmented, lots of sun damage, and you really see an improvement of her lentigines after a series of 4, diffusely all over the face, improvement of those fine lines, not so much the deep static lines in the perioral region, but definitely an overall improvement of her poikiloderma as well. Again, another patient, lots of sun damage with pigmentation, really a nice overall brightening effect of a series of 4 with overall healthier skin, as you can see. Like I said, appropriate for all skin types in my practice. You know, Asian Americans, darker skin types make about, 60% of my practice. So you can see improvement of, her lentigines, particularly on the nose, mid face. Obviously doesn't remove everything. I counsel that with all my patients, but this is why maintenance is incredibly important. Gives them a really great outcome after their, corrective phase, and then they go into a maintenance phase. Same beautiful BNAs, really improvement of those, fine rhytids on her lower face as well as, around her mouth as well. Smattering of lentigines and dyschromia in her mid-face, as well as poikiloderma with sun damage. You see that fine telangiectasias. This is without doing any sort of vascular treatments, but I do tell my patients that they will see an improvement overall of tone as a whole. Appropriate for men, we spoke about that as well. Safe to do in hair bearing areas. This gentleman here received a great result after just one treatment. Darker skin types as well, overall brightening of pigment, of fine lines, overall freshening of her skin. You see that improvement of a larger, I think it's a macular seborrheic keratoses, very stubborn areas. For this, I definitely use that C5 stamping technique. The other great thing with the Ultra experience is the fact that you can customize it, not just in terms of the treatments that you're performing with the laser itself, but also the combinations that you can do for skincare or skin delivery. So this is the Ampoule series that's available with Lutronic, and they have the ascorbic acid, 10% vitamin C, retinol, tranexamic acid, and resveratrol. In my practice, I do the tranexamic acid. It's the most popular, particularly because I see so many melasma patients, but these are really complementary treatments. We know that the 1927 thulium increases the absorption and the permeability of your skin tissue after the treatment, and these nanoliposomes that are the Lutronic ampules, once they get into the epidermis and they pass that stratum corneum, the skin, as we know, is lipophilic, and it's going to want to pull in these nanoliposomes in the skin. So I tend to do a series of 3 of Ultra for my melasma patients, and I combine it with the tranexamic acid. You can see here on this EM photograph that really it creates what's like a sponge. And I explained this to my patients, where basically the laser is making small little microthermal perforations in the tissue, and it really enhances, this complement of these ampules. So I know this lecture was really focused on the Ultra. I'm also a Genius user, and so I do total skin quite a bit in my practice. At first, when I started doing Genius, I did them separately, but now pretty much 100% of my Genius patients receive total skin solution, and this is the combination of the Ultra with the Genius, and it's marketed as total skin solution, or TSS as my patients know it, and you're really kind of addressing all the things when we're talking about skin aging, and we're using this intelligent technology, this very robust, comprehensive platform. Some people like to explain it like fluffing the pillow. So you're volumizing the tissue with laying down collagen and elastin in a meaningful way with your radio frequency microneedling Genius treatment, and then you're washing and ironing out the pillowcase with the smoothing out these fine lines and brightening the skin with addressing more superficial pigmentation. I use it all year round on all skin types. I, don't delegate my procedures, but this procedure is easily delegated and customized depending on whether you're treating really for kind of rejuvenation with pores, or if you're doing something more aggressive like acne scarring like I do in my practice, or even skin tightening, particularly on the lower face and the neck. So this is just a great histology slide that shows why we combine the Genius radio frequency microneedling with the Ultra 1927 thulium. You want to think of your Genius as more of the ablative component, but really bypassing the upper epidermis and upper layer of the skin. So it's really a colorblind procedure in a way where you can do it safely in different skin types. We have that precision with the intelligent technology with coagulation zones throughout the dermis, spares the epidermis, and then we're adding in that kind of focused, microthermal heating zones in that top several hundred microns of the skin. So you're really, one, helping minimize their downtime. Two, I think the biggest thing is that really significantly lowering or almost totally eliminating the risk of stamping or gritting that you can see with the more aggressive Genius settings that we often do for more of the lifting protocols or even the acne scarring protocols. Makes the treatment a lot more even. I found that many of my patients who I used to treat just Genius by itself, and now when I'm doing total skin, their downtime is significantly less and really minimize any sort of risk of post-inflammatory hyperpigmentation and particularly the stamping. So really this full treatment has really kind of changed my practice as a whole. With that, any questions that you may have, Dan and I are very happy to answer any questions that you may have with Ultra.
Thank you very much, Dr. Levin. That was an excellent, extremely informative presentation. That was really wonderful. Just as a reminder, please go ahead and type the questions into the Q&A box there within the Zoom chat. We had several come in throughout the course of the presentation, some really interesting questions, and I'll love to kind of throw a couple at you there, Dr. Levin, if you don't mind. Specific to the Ultra / LaserMD, and then I guess to another extent, the Genius, since you brought it up and talked about total skin so wonderfully. What went into that decision-making process?
Yeah, so I think that's a great question. So I'm the sole owner of my practice. Sometimes I think that makes it easier because I know my patient population quite well. I brought in the Lutronic platforms when it was just me as the only provider. So I, had such great insight in terms of what my patient needs are and what they wanted. I opened my practice with technology that I knew. And I was very comfortable with a hybrid resurfacing laser, which is the Halo, as well as BBL. And I love those platforms. I still use them quite a bit, but I realized that my patient population was skewing a bit more pigment forward. So I was, really looking for a 1927 thulium specifically. And the other thing is that I'm a dermatologist who does a good amount of medical dermatology, and my area of focus for medical dermatology is acne. So I treat a lot of acne scarring, and I just found that with the ablative resurfacing or non-ablative resurfacing with the diode, I just wasn't getting the results that I wanted to get because I know I had to be deeper. And really that's when I looked into different radio frequency microneedling platforms. We know that the Genius platform, I know this is not a Genius talk, but it is easily the hero in the market by far in terms of the technology, the energy it delivers, the consistency it delivers. So for me, what brought me to Lutronic was first the Genius radio frequency. And then I realized because I do so much melasma and so much pigmentation as well as darker skin types, I really needed something that I felt like I could safely do. And so that's when, Ultra came in. And thirdly, like I said, do a lot of acne and also rosacea. So I know this is also not a heel light talk, but I also brought in the red heel light. So I brought 3 Lutronic platforms at once. And, now I can easily say that they are my busiest energy-based platforms in the practice.
No, that's outstanding. Pigment forward. I love that. I'm definitely going to borrow that term if you don't mind.
Of course.
Well, and thanks for bringing up the helite. I think that is sometimes certainly not one of the more celebrated members of the Lutronic lineup, but it really is just a wonderful addition to any practice that brings it on. So, I'm very glad that you mentioned that. So I guess this actually sort of segues into the next one. So as much as people like to ask that question with pretty much any topic, the next logical question is, all right, what about settings and protocols? So you don't have to get too specific, but I think people are always curious. Dr. Levin, we know you get wonderful results. You mentioned, treating stubborn pigment, fine lines and wrinkles, treating a pretty diverse patient population. So how do you kind of make those decisions? And if you want to get into maybe any specific home run settings that you really enjoy, I'm sure people would like to hear about that as well.
My most popular is probably Total Skin Solution, easily, because I do so many combination treatments. So the Genius, I mean, the settings are all over the place, depending on whether I'm just, doing the Intella Juve settings or lift settings, and then definitely acne scars. So I'll actually mark out the areas of more atrophic acne scars. I'll treat the scars first. And then I'll then treat the whole face. I break up the different quadrants of the face, so the upper face, mid face, lower face, and I break them up to 4 quadrants as well. This has really helped me in terms of minimizing intra-pass edema, and then I will always follow up with an ultra. Typically, my go-to settings is anywhere between 8 millijoules all the way up to 15 millijoules, depending on the skin type, and like I said, how much pigment they have in their skin. And usually I'm at 2 passes. Sometimes I lay a bit more, particularly if they have a lot of PIH from acne scarring, and sometimes I'll go up to 4. I've even done 6 to 8, to be totally honest, to really push it to see how far I can get. And I've, to this day, knock on wood, haven't had complications with PIH, but patients have really seen a home run result with that. You do a good amount of Lay's MD Ultra on its own. Depending on what I'm treating, I may do anywhere between 4 to 8 passes. If it's a darker skin type, I might start him or her off at 8 millijoules or 10 millijoules and then kind of push up to 15, 20. Actinic keratoses, I'm usually doing anywhere between 15 to 20 millijoules, anywhere between 4 to 8 passes. For the Ultra Glow, which has only recently become more popular in my practice, and I think it's because patients really want very low downtime, or a lot of my patients are in kind of their maintenance phase, but don't want to have, a lot of that sandpapery downtime. So that's really that low energy setting at 5 millijoules, anywhere between 4 to 8 passes. Usually I'm at 6 passes. It's such a quick procedure, 5 minutes max. But really those are kind of my go-to settings. For that C5 stamping that I spoke to you about, really depends on what I'm treating. If it's a melasma patient, I'm going to be more conservative, maybe 8 millijoules. If it's a macular seborrheic keratosis, I might push that all the way up to 15. Same thing as an actinic keratosis, I'll push that 15 to 20.
No, that's wonderful. Thank you so much for getting into your settings. I know that's like gold to people. They love to hear, what the secret sauce is. So that's wonderful. Thanks for getting into that. And that actually answered a couple other questions that came in. A few people were wondering more about total skin and some of your combination treatments, but I think you've already covered a lot of that.
So I'm doing a lot of combination therapies with the different Lutronic devices. I do a good amount of, like I said, tranexamic acid ampules with the Ultra, which is incredibly popular with my melasma patients. And typically, sometimes I combine that with a chemical peel as their maintenance in between as well.
That's wonderful. You just hammered out about 3 other questions that came in. So you must you must have ESP. You knew what people want to ask. Well, I think a lot of times practitioners have a lot of the same questions. So I think this is so valuable for your peers to hear from someone like yourself who's so successful. I guess, could I ask a question? One thing that sort of pops up to me sometimes, and not being a practitioner myself, and this is really not even device specific. I'm sure that 99.999% of your patients are absolutely thrilled with everything. But what if you do get a non-responder or a patient who's not completely happy with really any treatment? How do you go about handling that? Because I've sort of heard different ways of going about that.
I mean, I think laying expectations is really important, and really patient selection, and then guiding them. I always tell people, like, it's kind of like you under promise and over deliver. I think patients nowadays, we live in a world that's very unrealistic. And, this whole filter economy and world that we live in, people think that it's normal to have this, incredibly porcelain, even skin. So I think, managing patient expectations from the get-go, to, the value of a series of treatments. That was something that I was very uncomfortable with. And, when I first started off, I'd be like, okay, let's do one treatment and then we'll see how it goes. No, I compare it kind of like, well, it's like treating blood pressure. You're not going to partially treat something. It's the same thing when we're treating the skin. And I think taking an approach like a physician, honestly feels more comfortable for us as physicians because we're so comfortable doing that. And because I do so much acne, it's like I say, it's me partially treating your acne. It's the same thing when I look at your pigment, fine lines, sun damage. I don't want to partially treat. So they understand that it's a series. And even after a series, I tell them it doesn't matter if you've gone through a series, you need to go through a maintenance because you will continually age. I can make you look better. I will make your skin healthier, but I cannot stop the inevitable, which is aging. So really that consultation is incredibly important. If a patient comes in, which often patients do, asking for a specific treatment, I'll always take a step back and, explain to them why we age, the changes that we see in the skin, and the reasoning behind why we do different energy-based technologies. Also, skincare. So I'm a big skincare person. I curate everyone's skincare routine. I really emphasize the importance of sun protection. And it's really because the patient also needs to be held accountable for maintaining the treatments that you are recommending to them. Because if you give them a great result and they go out in the sun and they collect all their freckles again, then there's a reason why they're unhappy. But sometimes ownership and accountability needs to be put on the patient. So sometimes I'm a bit stern about that. And then combination treatments are obviously incredibly, we know, effective, valuable. However, I don't like to pile all at once. So I like to kind of give patients stages. Right now, we're going to be focused on pigmentation, fine lines, or right now we're going to be focused on acne scarring, and then kind of move on to another phase so that patients understand that it's not just one and done, but it's a lot more complex and requires them to be a partner with us. And I think that's helped me a lot throughout the years.
That was incredible. That answer was amazing. He packed so much valuable information into such a concentrated nugget. We could definitely unpack that on a podcast or another webinar at some point. I'd love to do that. I'd love
Dan, you just want another podcast.
I'm just setting you up for the next one to be a recurring guest. Absolutely. No, that's really exciting. I'd love to even to be a fly on the wall when you're going through a consultation. I think that would be really interesting content as well. So speaking of content, we're just kind of wrapping up, just a few final seconds here, but you've done such an amazing job tonight. I wanted to give you just a second to promote yourself as far as your social media. You've got a great Instagram channel. You've got a budding YouTube channel. Just kind of put that out there to make sure people know how to get in touch and follow you and and track Entiere and Dr. Levin online.
Yeah, so you can absolutely follow me. I'm pretty accessible through Instagram, so you can absolutely DM me. My Instagram is Dr. Melissa K. Levin, which is spelled DRMKLEVIN. I also personally manage my practices account, which is Entiere Derm. That's ENTIEREDERM. And then, my associate, Dr. Finney, and myself, we actually recently started a YouTube series called Happy Hours with Derm. It's really our excuse to drink. But basically talk about
it's fun.
Things.
Yeah.
It's fun.
I enjoy it. It's different. You're finding a new way to get out there. And I think that's really exciting.
But I'm very open. You can email me as well. Any questions that you may have. I absolutely love helping other colleagues. The Lutronic platforms have really changed my practice. And so I'm more than happy to help anybody else navigate through these very versatile and effective platforms. So my email address is Levin, so mlevin@entierederm.com. That's ENTIEREDERM.com.
Outstanding. Thanks so much, Dr. Levin. We really appreciate it. I'd like to thank our wonderful audience for attending. We got some really insightful, intelligent questions. As I mentioned at the beginning, please don't worry if your question wasn't addressed. We've captured the entire chat. We'll be following up. Or feel free to email me, dsullivan@lutronic-usa.com, and we'll follow up with you. This presentation was recorded and will be available on demand at lutronic.com very soon. Thank you all again. Have a wonderful evening, and we look forward to talking to you again down the road. Bye-bye.
Bye.